Mr. Huelskamp, you're recognized for 5 minutes.
Thank you, Mr. Chairman. Dr. Lynch, as part of the VA's Accelerating Access to Care initiative, you've committed to ensuring primary care clinic panels are correctly sized to achieve the desired productivity. What are these desired productivity standards that you're using for primary care providers?
Right now, the standards they're using are the number of patients per physician. They do have models that they can use to see whether we can increase that capacity based on staffing or based on room availability or based on patient complexity. We are also beginning to implement the use of the productivity model to look at primary care and see if we can use that to take a look at not only the number of patients a physician is seeing, but the complexity of those patients and their productivity. So, for instance, perhaps a physician is seeing 6 patients a day. There are new patients or complex patients that have a high relative value unit. That physician may actually be more productive than a physician who is seeing 15 established patients during the course of the day. So I think,
and I do follow that. How do you monitor that, though?
Right now, we are monitoring that by looking at the RVU productivity of our physicians.
Is that monitored at the national level, the vision level, the facility level?
Yes, at the facility level.
At the facility level. Now, given the gaming strategies and other things that have have shown that the data is not valid or maybe not reliable, do we have potentially the same problems with what you're attempting to measure here? Why would we not have similar problems with knowing exactly what is going on with productivity?
Dr. Clancy?
I think that's an incredibly important question and one that we share your concerns and also recognize that since integrity of data has been a problem for us, we not only need to clean up our policies and streamline them, but that we also need to have some independent validation that these processes are both effective and that the integrity can be assured by an independent third party, and we will be doing just that.
So that has not been done?
Not yet, because the scheduling new policies...
So any of the data you've shared here has not been independently confirmed?
The RVU data is validated based on what we are recovering from the way that physician activities...
But if we have falsified data, and we have shown that, VA has admitted to that, the gaming strategies 4 years ago admitted that was going on. I don't know how the data could be valid or reliable in either case based on what Dr. Clancy just said. So I'm trying to find out how you can assure me that the numbers you gave here actually match what's really happening in the real world.
Congressman, point well taken. VA does need to establish the integrity of their data. I will take your comments back to the Office of Productivity, Efficiency, and Staffing and ask them how we can validate the information we have so that we can establish the integrity of that data and assure you of the confidence that we have in that data.
But the range you gave was 6 to 22 patients a day. That's your claim today, is that?
Yes, sir.
That's not valid?
I think that information is valid. I think it's very difficult to try to figure.
I had a whistleblower has approached my office from a facility, and I am in my congressional districts in 4 different visits. We're lucky that way, I guess, but claims that there are primary care physicians that see as few as 5 patients in an entire day. Now, that would be definitely outside the range. Do you have any other? Could that be possible?
I would have to look at the information and evaluate it. At this point, anything could be possible, and I'm certainly willing to look at anything.
I agree, and that's my problem here. When you say anything can be possible, this is not independently confirmed, but how do you make decisions when you don't know if your data is accurate? And, you know, gaming strategies, we've heard actually the falsifying data, and what I've heard from this whistleblower, and there's some really hardworking physicians out there, but there are some that are working very, very hard. And then physicians across the hallway, they see 5 patients a day, which basically half the day they're sitting there waiting for something. And obviously, when we're looking at ways to provide better access to care, ways we can do that by enhancing productivity, but we don't have the data, I think, to answer any of these questions. And so I look forward to you showing us how the data is valid and reliable. But if this whistleblower identifies physicians that are not working as hard as they should be, we'll have a problem in the system.
Congressman, I think we need to understand that further.
Okay. Thank you, Mr. Chairman. I yield back.
Dr. Ruiz, you're recognized for 5 minutes.
Thank you, Mr. Chairman.